I am Ms. Capilitan and I'll be discussing CLO number 9, which is to list down the nursing responsibilities before, during, and after thoracentesis. So before performing this procedure, the nurse should check the patient's chart for the doctor's order. The nurse should make sure that the doctor ordered this thoracentesis procedure to be done. Next is to identify the client. The nurse should make sure that the client is the correct patient for this procedure. Next is to ascertain if the consent form has been signed. So the patient must be aware and must make sure that he or she agrees to this procedure. Next is explain and emphasize the importance of the procedure. The patient must have knowledge on this procedure. Next, to inform that the patient will be experiencing mild pain on the site where the needle was pricked. The nurse should also inform the client that the procedure takes only a few minutes, depending primarily on the time it takes for fluid to drain from the pleural cavity. Next is to inform the client not to cough while the needle is inserted in order to avoid puncturing the lung. And then also to explain when and where the procedure will occur and who will be present. The nurse should explain the procedure to the patient and significant other, reinforcing what the physician has previously explained. The patient may have a diagnostic procedure performed prior to the procedure to assist the physician in identifying the specific location of the fluid in the chest that is to be removed. The patient may receive a sedative prior to the procedure to help the patient relax. The nurse should ask the patient to remove any clothing, jewelry, or other objects that may interfere with the procedure. The area around the puncture site may be shaved, and vital signs are to be monitored before the procedure. So the nurse should support the client verbally and describe the steps of the procedure as needed. So this is done to relieve or to reduce anxiety and for the client's cooperation. Vital signs are to be monitored during the procedure as well. The patient may receive supplemental oxygen as needed through a face mask or nasal cannula. And the nurse should also observe the client for signs of distress such as dyspnea, pallor, and coughing. The nurse should position the patient comfortably with adequate support. If possible, place the patient upright or in one of the following positions. First, sitting on the edge of the bed with the feet supported in arms and head on a padded over the bed table. This position aids in spreading out the spaces between the ribs for needle insertion. Second, straddling a chair with arms and head resting on the back of a chair. And third, lying on the unaffected side with the head of the bed elevated 30 to 45 degrees if unable to assume such a position. The nurse should also open the first layer of the thoracentesis set using the hands. Open the second layer with the use of the picking forceps and unwrap the materials aseptically. The nurse should also open the patient's gown and expose the side. Make sure to provide privacy to the patient. Perform skin preparation on the 7th, 8th, or 9th interspace midway between the posterior axillary line and midline, or a single interspace below the point of dullness to percussion in the mid-posterior line or mid-axillary line. Remove the sterile glove pack from outer covering. Hand the other pack of sterile gloves to the physician and arrange the materials inside a stock tray according to their use. Eye sheet, 3cc syringe, choker or aspirating needle, and the 3 specimen bottles and gauze. Loosen the lids of the specimen bottles. Give the following to the physician. So with the dominant hand, give the sterile eye sheet, the 3cc syringe, the sterile syringe for anesthesia. With the non-dominant hand, give the anesthesia solution. So this hand is now unsterile, so place it on your back after serving the anesthesia. Using your dominant hand, which is sterile, serve the 50cc syringe with an aspirating needle to the physician. After aspirating the fluid, hand the sterile gauze before he or she withdraws the needle, and then serve the sterile specimen bottle. Apply pressure over the punctured site using the sterile gauze and secure it with hyperallergenic plaster. So after the procedure, do aftercare. The nurse must make sure that the area is clean and all materials are kept. Next, observe changes in the client's cough, sputum, respiratory depth, and breath sounds, and note complaints of chest pain. Next is position the client appropriately. Some agency protocols recommend that the client lie on the unaffected side with the head of the bed elevated 30 degrees for at least 30 minutes because this position facilitates expansion of the affected lung and eases respirations. Document color, amount, consistency, and other characteristics of the pleural fluid. Include the time the procedure started and ended. Label the specimen bottles with the name of the patient, the room number, the date and time obtained, and the type of specimen. After, transport the specimen to the laboratory. The dressing over the puncture site will be monitored for bleeding or other drainage. And also monitor the patient's blood pressure, pulse, and breathing until they are stable.
Well, why not? What do you look?
CLO number 10. Document client responses and outcomes after thoracentesis. Documenting a client's response by monitoring the client's vital sign, as well as the client's level of consciousness as necessary, and writing it down in the nurse's notes. Documentation of the client's response is important as it will notify healthcare providers on how the client's body responded to the procedure and to know if there are any complications.